My name is Ashley Dobbe, and I'm here to talk to you about hip dysplasia. Hip dysplasia is a deformity that occurs where the hip socket doesn't completely develop. This can happen in utero, or it can develop as your child grows. The hip socket forms the cup of the hip that sits around the ball of your hip. If it does not appropriately develop, then we get a shallow hip where the hip can dislocate out of joint. Even with careful examination, DDH can be missed. Some ways of detecting hip dysplasia are on the newborn exam when a clunk is felt, or that the hip is loose and is not able to stay in joint. And if there are any further concerns, that investigations such as ultrasound be completed. Some indications for an ultrasound would be breech positioning or a strong family history, or any abnormal findings on the newborn exam. Some signs that may occur as your child gets older is a leg length discrepancy with one leg being shorter than the other, or a waddling gait or limp. If these signs do occur, it is recommended that your child be referred to an orthopedic surgeon for further assessment. Our goal is to treat DDH and aim for correction in the early stages to prevent any further complications as your child grows. Treatment usually entails what we call a Pavlik harness. This is a dynamic harness that holds the position of the hips in a quote-unquote froggy position with the hips abducted and flexed. The Pavlik harness is one of the most commonly used braces, and it holds the hip in the corrected position to allow the hip to develop properly. It's important to know that early bracing will not have any significant impact on the gross motor development of your child and their walking. Newborns with hip dysplasia tend to respond well to bracing treatment. However, surgery may be needed in cases of children that are diagnosed older than 6 months of age, or those who do not respond well to bracing treatment. It's important to remember that only a small percentage of cases require surgery. The type of surgery would depend on the age of your child or the severity of the hip dysplasia, and this can be discussed further with your doctor as it is a case-by-case basis. Development dysplasia of the hip is a very common hip deformity in the infant, and it's important to remember that it's not your fault. When detected early, it can be treated quite effectively with the use of the Pavlik harness. The brace is found to be over 90% effective in the treatment of hip dysplasia, not requiring any further management.